Hi, I'm Dr. Randy Martin, and I'm pleased to be joined by Dr. Morten Schou. Dr. Schou is from Denmark, and in Denmark they have 40 hospitals and they have a network of heart failure clinics that are really joined together. And he has a fascinating study where they looked at could they organize a way to really manage and decrease morbidity and to some extent mortality in patients with stable heart failure. Morten, thank you for joining me. Tell me a little bit about this.
Yeah, we conducted this study because more and more patients become clinically stable, and we asked ourselves, where should these stable patients on optimal medical therapy, where should these patients be followed? When we launched the study, it was routine that they was followed by the GP. But then we asked ourselves, can we improve outcome in our heart failure clinic despite they are optimized? And we thought we could that, because if they were in the heart failure clinic, we could maintain adherence.
Got it.
And we could prevent readmission.
So in essence what you're doing, you've got patients with heart failure, you've got them optimized on medical therapy, and then you want to see how do you keep them that way, or look at outcomes. Isn't that right? Whether you can turn them back to their GP, or should they stay in a specialized clinic? Is that correct?
That's correct. And then we hypothesized, because we have worked with the biomarker NT-proBNP, we had the hypothesis that NT-proBNP could identify the patient who needed to be followed.
Okay.
So the high-risk patient needed follow-up, but the low-risk patient did not.
That
great. Was the hypothesis.
Well, no, I mean it makes sense to me now. So what did you find?
We found that in the main study, heart failure clinic versus GP, there was no effect of being following in the heart failure clinic. And NT-proBNP actually did its job and identified the high-risk patient, but our intervention could not improve outcome of these patients.
Really?
Yeah.
That's very
So NT-proBNP did its job, our intervention failed.
Where do you go from there? So I mean, if that's what you learn, how does this impact your practice?
Yeah, I think what we now know in Denmark is that we can say to the patient, you are now on optimal medical therapy, you have only minor symptoms, and we can now discharge you to your GP, and we know that is safe, and we know we cannot improve outcome for you here, and that's a good message for the patients.
Yeah, but it sounds very, very good, and it's certainly a very fascinating study, not only for the network and the implications of that, but for the markers that you use. Thank you very much for joining us, Dr. Schou. That was great. And thanks to each of you for joining us. For Cardiosaurus Video News, I'm Dr. Randy Martin.